Okay, let's talk about orthotics for a supinated foot. Okay, so when we talk about a supinated foot, it's just the opposite, as many of you know, from a pronated foot. So if you look at the foot from behind, when somebody's overpronated, they're rolling in and they're dropping here. Their heel rolls in and the mid part of their foot drops. Okay, we call that overpronation. Okay, a certain amount of pronation is normal because that's what allows us to absorb shock. Okay, but people that overpronate through the whole stance phase of their gait, as they're pushing off, they're overpronating. That's what causes all these damaging forces and damaging stresses to the foot that can cause tendonitis or whatever going forward. A supinated foot is a foot where you can see people walking on the outside. They're actually kind of turned out to the side this way. Okay, people that have a supinated foot tend to do a lot of inversion sprains. They tend to sprain their ankles quite a bit. Okay, so what we attempt to do with the orthotics is to try to move the foot more into more of a pronated, or more back to a neutral position. So we have your orthotic. These are going to be high arched feet. Okay, so that arch of that foot's going to be really high up over here, and kind of almost going to look like this. Really high up this way, and then rotate it off to the side. I've seen some really severe cases of a supinated foot. And of course, there's different reasons why people supinate as a compensatory mechanism, which we don't have to get into now. Okay? But essentially what we do with the orthotic is, so this is the arch. We're actually going to be posting the orthotic so it's a little bit thicker, a little bit higher on the outside. Okay, to try to get them, to push them a little bit more, we call it medially, or towards the inside of their foot. We're also going to try to, in a sense, keep that post through the entire outside of the foot, if we can. Okay. Sometimes we stop right here. Sometimes we go all the way forward. Okay. This actually says a supinated foot with a forefoot valgus asymmetry or deformity. So, as you can see here, you see that okay, Meg?
Yep.
We see this angle right here. It's actually higher on the outside over here, and then lower on the inside here. So in a sense, I'm trying to tip their foot inwards from the rear of the foot inwards, push it towards the arch, and on the forefoot, same sort of thing. I'm trying to push them more in like this to try to unload and take some of the stresses, some of the biomechanical stresses off of the supinated foot. Okay, and that's it.